All right, this will be a dressing change for our central line. So it'll be central line dressing change and blood draws from our central line. First of all, you need to make sure that you've got a central line dressing change kit, and it is a sterile procedure, so it all comes in this sterile pack. You need a mask for yourself, and I'll go ahead and put this one on myself, and then I've got one in the kit that I'm actually going to put on my patient. Obviously, our patient doesn't have a head here, but we make sure that when we have patients that we put a mask on their face and we turn their head away from our central line site. The next thing you'll need is for our blood draws is our transfer devices. So a little bit of thing that looks like this. I'm gonna draw a PTT and I'm gonna draw a CBC. So that's what my doctor's orders, because I would have checked my orders for my blood draws and to find out what's needed. So for these two tubes, I need at least 4 to 5 mLs of blood specimen. I will also change, show you how to change your caps on your central line that comes. And then these are just a couple of flushes that you'll need for supplies. You'll need your Kuros, that kind of goes on the end, and these have to stay on your patient for at least 1 minute so that your end of your catheter is sterile. And then I'm gonna grab 2 syringes, 2 10 ml syringes for my blood draws. One to just pull up my blood to discard, and then the other one is gonna pull up my sample. Okay, so I need all of that. So when that, check the chart, go by your hospital policy as to when you will change your central line dressing changes. Some places it's every 7 days or unless soiled and as needed, so we would have to change it before then. And then I get myself a specimen bag if I need it for my hospital to send my blood to the lab. So I'm gonna start by cleaning my hands, washing my hands, talking to my patient, explaining to them what I'm going to do, especially if I'm going to wear a mask. I would at this point in time put on some gloves. I have to change out this dressing to pull this dressing off before putting on my new one. With this dressing change kit, it has the little bio patch or the little sterile solution inside of that that goes right over your central line opening. For the purposes of this video, I'm not gonna actually move this dressing, but I'm just gonna walk you through changing the dressing without moving it and then what you would do, so what's in your kit. So I've got everything going. I've identified my patient, introduced myself, explained what I'm going to do with my patient, cleaned my hands, did hand hygiene, put on my gloves, and put on my mask. So at this point, I'm going to go ahead and just put on a mask. All right, so I've got on my mask. My patient now will have on a mask because inside of this kit, and I'll move this stuff around until we're ready to do our dressing, our blood draw. So inside of this kit, as I open this kit for you, again, everything is here sterile. So I've got a mask like right on top here. I'm going to take this mask off of here, and I'm going to put it on my patient. Let's just say my patient has a head there. Okay. All right, not going to stay there. Maybe not. Maybe. Okay, so they've got a mask, and then I want to turn their head away from my field where I'm going to actually be doing the dressing changes. At this point, I will go ahead and put on my sterile gloves. So I have to do sterile gloves at this point. All right, so I'm opening up my sterile glove, and I'm going to step back a little bit and put on my left hand first. My right hand is my dominant hand. And then I will grab my next one, my right hand. Careful not to let anything touch my hand to touch my glove except for the sterile glove that I have. And there, voila, I've got on sterile gloves, okay? So this one we're done with. And then here's a little drape. So if your patient was laying down, you would open your drape, put your shiny side down if you had a patient, but this is chest or chest that we're using. So I would open my little sterile drape here, shiny side down on top of Chester. All right, I've got several things in here. Got some tape. I've got a Chlorhex. Pat is what we're going to do. I've got alcohol swabs, so we're going to use also to kind of clean, and then we can put on the final our dressing change. So in here, we like to kind of start pulling off the dressing, and sometimes I'll use like a little bit of an alcohol pad to kind of clean the dressing. So I'm using it. I'm getting my dressing and everything off with my dressing now. I wouldn't actually, because I'm not going to take off this dressing, I would actually use my sterile gloves after all of this dressing's off. So let's just say all of our dressing is off for this patient. This is my Chlorhex. I would break it, so you would squeeze and break. Now, there's no dressing here, remember? And then I would start and I would scrub. All right, scrub for 30 seconds, and we would go scrub here for 30 more seconds, cleaning the area to make sure that the area is good and clean. All right, we will allow that area to dry. Okay, over that for that minute. So then we're gonna allow our area to dry, and after our area has dried, this little dressing has a couple pieces to it. Do you see where all of your ports are coming out? Okay, these are all of your 3 ports, because this is a triple lumen. We can do a double lumen. Sometimes we'll have a quadruple lumen, or quad as we call it. But with this dressing, you've got several pieces to it. This piece has this little opening in it. As you can see, that little opening there, that is going to go up towards where your triple lumen and all of these. So it will go right across there. Your little yellow piece that's in the middle, which is what we would normally say our biopass for sterile, that keeps the germs away or keep infection down. We want that to go right underneath that, Our openings for the triple lumen to go between that. And then this last piece over here, we would pull it off because it also has a little opening in the middle, and it's going to go underneath. So underneath your dressing across there. So then you would have a full dressing in this one. After that one is done, then you would also take, there's a little piece across here that we would pull off. I don't know if you can see that little piece across the top. We would pull that across and put it on top of our dressing, and then we would date, time, initial the dressing, so they will know exactly when this dressing was changed and when it is due to be changed again, unless it gets soiled, okay? And then after that, sterility, you're done. You don't have to worry about, once you got this all covered, as far as the dressing site itself. Now, for these little ports, okay, there are 3, since there's 3 triple lumen ports, I'm going to get rid of all of this stuff, and I'm going to show you what we're going to do, because after we did all of that, we can actually kind of change out our gloves if we wanted, if we needed to, or whatever. But you will take your saline here, right? So we've got normal saline. This is our flush. So we would take our flush. These are our ports. If we needed to change our ports, these are our ports. So they look like this, just like the ones that are on the end of here. What's on here is the little curl. So your port would look just like that. Now, in order to change our ports, when these come into a packet like this, we have to flush these out. Otherwise, we run the risk of putting little air bubbles in the patient. So open our sterile, get the bubbles out of our saline here, our little flush. So we got our little bubble out. Oops. And then we would open it, keeping it sterile, and attach our saline to our little port that we have to flush. And we just have to put enough water in it that it comes out the other end. So I don't know if you can see that drip. Okay, so we're good. So we are now flushed and ready to go. We keep our flush attached to it, okay, just like this. If we're going to change the port, which I'm going to change this port out, we make sure that we clamp it off, make sure that this little area is clamped. So we want to clamp it down. Take our little thing off of here, take the one that's off, put our new one on, and then we can unclamp it, flush it out. I'm not going to put any water in this, obviously, because this is chest to chest. Flush it out. We're done. Clamp it back on. So we know we've got everything clamped and ready to go. We can take one of our little Curos devices thing, because this helps sterilize. It just has to stay on the patient for 1 minute. All right, and then we would do the exact same thing to change out all of our ports. So once all of our caps are changed, we're good. So here, now, if we wanted to draw blood, because we have an order to draw a CBC and a PTT, INR. If we wanted to draw blood, we'd have to determine how much blood we needed for this. So for this, I've determined that since my PTT has to be completely full, I need 3 mLs, and then I could do 2 mLs in a CBC, even less than that, and it will run. So I'm going to just say I'm going to draw 5 mLs of blood up. So in my port, if I have IV fluids running through these ports, then I would have to turn them off for 1 minute. If by chance I have medication or anything that's going through the port that I cannot stop because of the danger for the patient, then I would have to do a peripheral blood draw. So since I can get blood, we just have normal saline, just IV fluids. I'm gonna stop my fluids for a minute. I'm going to clamp off my port, and then I'm gonna take this port and I'm gonna draw blood from it. So with that being said, I'm gonna also pretend that I'm changing this port as well. All right, so I'm gonna clamp it down while I'm waiting for my minute. I'm gonna change my cap, I'm gonna put it there. I'm gonna unclamp it, flush just a little bit, and then I'm gonna take my 10 cc syringe. You don't wanna pull with anything bigger than this 10 cc, okay? This is gonna be my discard. So I can take my flush, clamp off my fluids, put my syringe on there, and I'm gonna draw up about 5 mLs or so, and then I'm going to discard that. That's gonna be the blood that I'm actually gonna throw away. Never push blood back into a patient's body because of the risk that when it comes out that the blood could clot and you could throw a blood clot into the patient. So we would discard that 5 cc's of blood. All right, then we would take our syringe that we're getting our sample with and we would attach it, and then we would pull out our blood. So we're pulling out 5 mLs because that's all we really need. All right, we can let that go. We want to just leave it there just for a second. We want to take this and our transfer device, which looks like this. I'm going to just screw it on here so you can kind of see what it looks like. This is what it looks like, okay? And then we will take our tubes and get our blood. Blue will always go first, so we will put it there, and it will, all our blood will go in our tube. So once it's full 3 cc's, we will take that one, invert it to make sure that it's okay. Then we will get our CBC, and simple, if we need more blood, we will draw more blood, okay? That's done. All right, then we would take our flush. All right, we would have to clean our port because we kind of left it out. We would clean our port and we want to flush it out. We want to get the blood out of the tube, and we want to go ahead and just flush with a few cc's. So we flushed it, clamped it off. If we had fluids, we would start our fluids back at this moment. If we don't have fluids, we would just clamp it, and we would get ourselves a clean Curos device and put it on the end of it just to keep that end sterile. And that would be the end of getting our blood draws and our changing our dressing here. We would take our lab and we would label it at the bedside with the patient's blood label, and we would take it, put it in our little biohazard bag, send it to the lab, go ahead and clean up our things around our patient. We can take their mask off at this point in time now that this is covered. If you're comfortable as a nurse, you can take your mask off at this time, or you can keep doing it. But we would just discard all of our supplies, including our transfer device, our blood that we drew up, and then that would just be it. And then we send it on to the lab. So yes, thank you so much.